Hi, I'm Ashley. I'm a student with Dr. Fristo. I'll be checking you out today, and he'll look after me.
Okay.
How are you today?
I'm alright.
You're all right. I'm sorry. You're just all right. What brings you in today?
I've just been like really weak lately and just having some shortness of air.
Oh, that doesn't sound pleasant.
Yeah.
When did it start?
It kind of has been going on for a little bit, maybe like a week or so.
It's a week or so. What are you doing when this happens?
Usually I notice it more whenever I'm like walking or like doing any kind of activity.
Yeah, and it's just shortness of air in your chest?
It's just kind of like everywhere. I mean, I just can't get enough air in, and I just feel like off.
Okay, like you don't have enough energy or something?
Yeah.
How long does it last?
Pretty much like it starts shortly after I like start like walking and doing the activity, and then I'll like sit down and it'll kind of be there for a little bit, but then it'll kind of get better.
Okay. Does it like interrupt you when you're like doing cleaning or showering or other things like that?
Yeah.
Cooking?
I just can't do like what I used to anymore. Everything just wears me out, and I just get tired doing everything.
Okay. Does anything help it?
Just resting, sleeping.
Do you sleep a lot more than you normally do?
Yeah.
Your weakness, it's an overall weakness? Is it in one particular area of your body?
No, just like whole like weakness. Like I just feel like my whole body's run down.
Okay. And so you feel kind of run down all the time, but when you start, is the shortness of breath all the time, or is it just when you're doing something?
I don't know. It's kind of all the time. I mean, it's worse when I'm doing stuff, but sometimes I'm just like, I just get short of air like easily. Even if I'm sitting there, I'm just kind of I just can't catch my breath sometimes.
That doesn't sound good. So when you are walking like down the hall or to the bathroom or something, it's just much worse, much harder.
Mm-hmm.
Okay. Have you ever passed out or fainted?
No.
Okay. So like from 1 to 10, 10 being like I am the most uncomfortable ever, and 0 being none, like kind of where does it fall on like your weakness?
I'd say like 6-ish.
6-ish.
Yeah.
Okay. Do you have any allergies to anything?
Nope.
No. Do you have any medical conditions?
Yeah, a lot.
What have you been diagnosed with?
Hypertension, diabetes, had menopause already.
Have you had a heart attack?
Yeah.
How long ago?
A couple years ago.
Did you have stents? Did they...
Yeah, well, that's the stuff they, like, put in, right? Like, they put, like, a little thing in.
Yes.
Okay, yeah. I think so, yeah.
You didn't have open heart surgery, right, where they cut you down the middle in your chest?
No.
Okay.
No. They just put, like, things in to help my heart.
Okay.
Yeah.
So what kind of medications do you take?
I take, like, metformin, Cinepril, that medicine for the stents, I think it's called like Plavix or something, and then like baby aspirin, multivitamin.
Take anything for blood pressure?
Cinepril, maybe another one, like a little blue one, like starts with an M.
Metoprolol, maybe?
Yeah.
Okay. Anything else? Do you take any like herbs or over-the-counter medications?
No, just like a multivitamin.
Okay. No, like not aspirin. No, like Tylenol or Advil or anything like that.
Nah.
Okay. I'm just gonna ask a little family history too. So, are your parents still with us?
Oh no.
Okay. What did your mom have in her life or passed from?
My mom, we all smoked, and then she got lung cancer, so she died from that.
Okay. What about your dad?
My dad, excuse
Bless
me.
you.
He had a heart attack.
Okay, a heart attack.
Yeah.
Well, that's unfortunate. Okay. Well, I'm gonna just check you out. Maybe ask you a few other things. And is there anything else that you're worried about? Just to recap, weakness, and you're feeling just like you can't move around like you used to, and really short of air, and you can't always catch your breath.
Yeah.
Okay. Have you had any unexplained weight loss or weight gain recently?
I think I put a little bit of weight on. I mean, I'm just a little bit more fluffy than I used to be.
I understand.
Yeah.
How about your blood sugars? Do you check those regularly?
Yeah.
Yeah.
Like, I try to do it every day.
Okay. So you skip some days?
Yeah, but my metformin covers me.
Okay. You don't have to take insulin?
No.
Okay.
I don't think I'm supposed to.
Okay. What about your heart medications, your blood pressure pills? Do you always take those on time, or do you miss those?
I got those in a little box.
Okay, that's good. Do you have any kids?
Yeah.
Do they come visit? Can they help you out with anything?
Yeah, my son checks on me all the time.
Oh, gotta love those annoying sons.
Yeah.
Well, I'm gonna wash my hands here and just kind of listen to you, listen to your heart, and kind of check some things out.
Okay.
Sorry that you're feeling so bad.
Yeah.
I'm gonna sneeze myself. Excuse me. Sorry about that. Have you had any feeling of palpitations or chest pain lately?
No, I don't think so. I mean, I can feel my heart racing sometimes when I'm like doing stuff.
Okay. And then no, you don't sweat a lot, or like all of a sudden break out in a sweat.
Nah.
You don't have any like indigestion, nausea, or vomiting.
Nah.
Okay. No like sore throat or any infections recently.
No.
Okay. And you do smoke. How much do you smoke?
Like a pack a day.
A pack a day.
Mm-hmm.
That's not very good.
Well, I know.
You need
We
to-
all smoke though.
Thanks. Well, that's not good. We'll see what we can do about that. I'm going to listen to you really quick here. Just take a deep breath. And out. I'm going to listen to your backside here. Okay. I hear a little bit of crackly wetness down in the bases, down here anteriorly and posteriorly, so that's a little worrisome. That's not the most normal. I'm going to listen to your heart now. Right in here, sorry. Displace you. I can tell that your heart rate's a little tachycardic. It's kind of about like 110, 112. Does anyone in your family have a history of atrial fibrillation?
I think my sister had that.
Okay. It sounds pretty regular, but you just have to watch for that. You don't have a heart murmur or anything like that, so that's good. I'm going to check your pulses, okay? Good. Check your carotids here. 2+. Excuse me. 2+, so you have good, strong, regular pulses in your radials and your carotids. I'm going to look down here at your feet. I'm going to take your shoes off for a minute. Fair and square.
Sorry.
It's okay.
It stinks.
It happens. We all work. Let me see your feet here. And check your dorsalis pedis. It's okay. You have a little bit of edema here. It's a little bit pitting, about a 2+. It just seems to be in the lowers.
Yeah, that's kind of been like that fluffiness.
For how long?
I don't know, maybe
Like
a couple weeks.
A
Yeah,
couple weeks?
maybe.
I'm going to check your cap refill. Good. It's about 3 seconds. Let's fill up here. See that? No clubbing. Good refill. You're warm and dry. So that's good. But you're pretty edematous down here. How do you weigh yourself every day? Did the cardiologist ever tell you to do that?
Yeah, I kind of just go by how my clothes fit.
How are they fitting nowadays?
Well, a little tighter.
A little tighter. That's not good. Well, I don't think there's anything else that I should really check. You're not having any nausea or vomiting?
No.
Okay. Well, let me do some vitals here and get your blood pressure. Check that. 136/72. And your heart rate was about 110. Yes. It's pretty regular. Take your temperature. 98.7, so you're good there. Respiratory rate's about a 19 to 22. Let's check your oxygen level. You don't need to wear oxygen, or anyone in your family ever have to wear oxygen?
Yeah, my mom did.
Okay. It's 94% on room air. Well, that's not bad, but we do like it a little bit upper. I'm worried about things with your history of having a myocardial infarction or a heart attack. That's damage to the heart muscle, which could mean that it's not pumping like it should. And we have some other things. And do you work out? Do you get out any activity lately?
I walk my dog a little bit.
What's a little bit like around the block?
Yeah, it's a little thing, so she doesn't need much exercise.
Okay. Yeah, I'm just a little worried. Your lung sounds clear, just a little wet in the bases, which tells me you might have some congestive heart failure, especially with this peripheral edema you have going. So you might need to get that checked out. You need to weigh yourself every day. I might refer you to a cardiologist. We'll get some labs drawn up. But I can't rule out some COPD-related problems from smoking. That is not good. That could be causing some of your dyspnea, your shortness of breath. And you could have an infection, pneumonia, but it's looking more to me like you have some congestive heart failure. But we're going to get some labs, we're going to get some tests, and then maybe send you to the cardiologist and just make sure that you don't have any other issues. Maybe even get a venous Doppler for your lower leg, just to make sure you don't have a blood clot or something like that.
Oh, okay.
Okay. I'm sorry you're not feeling so well, but we'll get this worked out. It was
Okay.
nice to meet you.
You too.
Have a good day.